Hey everybody, welcome back. This is Dental Unfiltered. I'm Matt Brown. I'm here with my normal co-host, Dr. Vallo. We have an awesome show for you today. It's called Treatment Follow-Up Letters. We had a podcast guest, Kelly Schwartz, and he gave a tip for growing collections. It was an easy, simple tip, and Andrew has executed it and had amazing results. And Andrew wants to talk about what the tip was, how we executed it, and what the results were, and how easy this was. So Andrew, you got really excited. You sent me a text message like, "Hey, dude, I did what Kelly said, and I had this amount of collections in 30 days from it, and it worked." And you tracked it because you track everything. So tell us a little bit about what you did and how effective it was and how easy it was to implement it.
Yeah, man. So we actually just very recently launched it. So this is super early results, but I'm so fired up about this new system we have that I wanted to again, I know Kelly touched on it during his podcast, but I want to go into more detail with exactly what we did. Before I get into the conversation specifically about the follow-up letter, I did want to mention, guys, I think this is one thing, and you know what? Like we always analyze like, hey, what are our strengths and weaknesses? Or we should be, and we should be looking for people that complement us well. I would say big picture, I am more of the visionary CEO, new ideas. I've never taken actually, I was at a course where they were talking about the different assessment tests, the Colby and discs and thing like that, which I think is a good idea, and I think we'll probably start implementing that within our organization as well. I've never taken any of those tests, but I can tell you, like, I am a quick starter. Like when I hear an idea, and I think it's a good idea, like I can't wait to roll it out. I don't need to ask 10 million questions before. I don't need to find like the absolute perfect uh system or absolute perfect scripting or whatever it is. It's like I want something that is going to be effective and I want it quickly because I don't want to waste time. When we waste time, we lose momentum, and other things come up and we never get around to it. So I mean, if you think about how many times have you been to a course? And for me, these days, it's mostly business. I mean, at this point, I'm not practicing clinical dentistry, but the most course I go to are business related, but it could be something clinical as well. How often do you go to a course, learn something, learn a new technique, learn something about your dental business, and think this is a great idea, and then come home and it sits in a notebook you had or a binder or whatever. Maybe you mention it to someone on your team, but it never happens. So I'm going to challenge all of you. If what I just described is your kind of normal routine, you go and you learn information, and then either you spend so long analyzing and thinking about it, or you just get back to your daily routine and forget about it. I'm going to challenge you to kind of change that way of thinking. Try to be if you are the CEO, whether it's a single office, multiple offices, if you are the owner, founder, CEO of your dental group, you need to be a visionary, or you need to get somebody, at your head table who is that visionary, that quick starter who's gonna, jump on that next idea. Now, my implementation isn't always 100% there, and that's why I've got my operations officer who often does the actual implementation of things or finishes what I start, or whatever it is. So that, again, that's why it's important we have people that complement us. But I would say that's one thing that I do well is I hear an idea, I like the idea. As quickly as possible, I start working on getting things set up so we can roll it out in an organization. And that's what happened with Kelly's letter. It was just, I think, a couple months ago that we had Kelly on. We were talking to him. Middle episode, I said, Kelly, I'm going to do this in my practice. This is such a good idea. And so what were the steps that I then took to make it happen? I started, at like meetings that I had with our office man. We had our quarterly meetings. I guess, yeah, it must have been like mid-January when we had Kelly's thing. Cause I think right after Kelly's interview, I started to have these quarterly meetings from the previous, we always do them, like halfway through the month after the next quarter. So had the quarterly meetings from Q4 from last year, talk to all the OMs about it. So I'm kind of planting the seeds. Hey, this is an idea that I got from a dental podcast host or guest. I think it's an amazing idea. I'm going to start working on kind of the logistics of it and exactly what I think I want to do. And then together with the leadership team, we're going to work on getting this letter written up and standardized and kind of rolled out to everybody. So I start planting the seeds early. I don't like just coming to my team and being like, hey, here's this letter. You need to start sending it out. So I like to inform. You don't necessarily have to inform everybody on your team, but you need to make sure at least, the leaders in the organization or whoever is going to be handling that task, inform them early on, kind of have them involved throughout the process a little bit. So that way it doesn't seem like you're just giving them work all of a sudden. That's going to decrease the likelihood of it actually implementing correctly or quickly or sticking or whatever it is. So I let all of them know, and for the most part, very positive reactions. Everyone seemed on board with the idea. Then, as I got time, I started crafting actually, I had my partner, Sasha, who you guys probably have heard in the podcast now because he's got his clinical section. I had him run some stuff through ChatGTP for me because I still have never used ChatGTP, although I did ask him to teach me how to use it. I'm assuming it's not that hard, but I do think I need to start leveraging AI, even though I'm not much of a techie. So I had him run this stuff through ChatGTP for me. He sent me back 2 different versions of the letter from ChatGTP. I picked the version I like better. And then I just started kind of editing it, making it more of my own. And I honestly, it probably took me a half hour to edit this letter. It's a 1-page letter to patients from following up on treatment. I got it to sound as, much authentic, like coming from us. I want it to kind of be like the way that my office, my team speaks. I wanted to make sure that it was getting the right message across, the right tone, all those things. So I created this letter. And then what I did is I kind of customized it for each office. So this is one of those things where I probably could have delegated, sent one letter to each of the OMs and had them customize it. But honestly, at that point, I wanted to make sure everything was done exactly how I wanted it to. My thought is, if I can make this letter perfect, I never have to deal with this letter again. And it's going to have such a leveraging effect over the long term for our treatment follow-up. So I did. One of the few tasks that I kind of did for the most part, start to finish, other than the initial draft from ChatGTP, got the letter set up exactly how I wanted it, customized it for each office and each doctor, sent it to our OMs and treatment coordinators in an email with instructions. I had my operations officer on the email, so he knows exactly what I want there too. This is exactly what I want for these letters. And basically what it is it's a letter to our patients who don't move forward with treatment that's presented. And it's supposed to go out about 2 weeks after their treatment presentation. So basically we've got our 222 follow-up systems. The goal is always that our treatment coordinators try to get commitment for as much treatment as possible while the patient is in the office. So they actually, as I think I've talked about on a previous episode, they actually record their daily results, what percentage of the people they present treatment to put some kind of money down. And I actually have them handwrite it with the patients and everything, because I do feel like there's some value in handwriting things, and it takes them a couple minutes throughout the day to do it. But at the end of the day, they have to look at their sheet. They have to calculate their percentage for the percent. And the goal is 65 plus. So our goal in our offices is at least 65% of people put some kind of deposit down for treatment every single day. And when they're at 80, 90% or even 100%, that's an amazing day. And we celebrate that. Because they have to then email them to the office manager, operations officer. My operations officer tracks everyone's treatment acceptance rates throughout the week. He sends out weekly standings. So we've kind of gamified it a little bit. And it's kind of exciting for our treatment coordinators to do that. But anyways, anyone who doesn't commit to treatment at their exam consultation, they go on the 222 follow-up list. And it used to be 2 days, phone call, voicemail. If they don't get them, text message to follow up. If they don't, answer the phone, 2 weeks, same thing. 2 months, same thing. Pretty standard. A lot of offices do it. I had the idea of inserting my version of Kelly's treatment follow-up letter 2 weeks after their treatment's presented. So basically it gives us 2 opportunities to close treatment before we have to go through the effort of sending out this letter. Did you know stamps cost 73 cents these days, by the way?
What?
I guess I hadn't bought a stamp in a really long time.
I remember they're like 25 cents.
I was gonna say, like, in my mind, they're like 40 cents or something like that. So I guess maybe inflation has
That's
hit.
almost $1 per letter.
Yeah. Now there's ways around it. When you do these mass postcard mailings, you get so like I still can mail mass. I don't do it often. I'm not a huge fan of this is neither here nor there. I'm not a huge fan of mailers in general, but when I do it, I can still mail them for about a cost of like 25 cents per mailer. But if you're just doing a traditional letter with an envelope and a stamp, stamps are now 73, 74 cents. So anyways, the goal is to get as many patients to commit to treatment either in office or at that first 2-day follow-up. But for anyone who doesn't, I want this letter to come out fairly quickly. I want it still fresh in their minds. And I think if we wait too long, it's way less impactful. So 2 weeks, it doesn't have to be 2 weeks to the day, but basically the week that anyone's due, they're sending out these letters and they're tracking the letters that they're sending out, and we're tracking results from these letters and all that, like Matt mentioned. And the letter essentially says, hey, patient name, I wanted to personally follow up from your last appointment. And, more or less it's saying we discussed some treatment needs. It's kind of generic in the sense that it could go to any patient that needs treatment, but we discussed some treatment needs. They obviously they are a concern or priority for me. I want to help get this taken care of for you before these conditions have a chance to get worse. And it says, like, in effort to help make it a little bit easier on you, I've authorized my team to extend a special or secret or whatever discount on your treatment plan. To receive a copy of your new discounted treatment plan, just send us a text at this texting number or send us an email at office email address. And then it's, please feel free to let me know if you have any other questions about your treatment, if you want to discuss the options anymore, things like that. I look forward to seeing you again soon. On the envelope, the address that we're mailing it to is handwritten. So, it's not typed on the computer or anything like that. So I get a handwritten address with it. The letter is typed, so we can just print a stack of these letters. But the doctor's signature is signed in ink. So basically we'll have a stack of these the doctors can sign. And then we asked that a little short one, again, I stole most of the stuff from Kelly, so I'm not going to take credit for this genius idea, but we write a little quick message. If there's something that we remember talking to the patient about, if there's a note in the chart about they're taking a vacation or whatever else it is, it can specifically reference that. And if there's nothing specific like that, then we've kind of just got some generic phrases like, I can't wait to see you at your next visit, or it was a pleasure seeing you the other day, whatever it is. So that something little is handwritten, at the bottom of the letter as well. And then if we want to take it up a notch, I didn't require this because I don't know what the workload's going to be on my team that's already very busy, but I did tell them, if you really want these letters to be effective, if the patient has any great IO pictures, x-rays, anything like that, that really show the issue that, the major issue that we're talking about, feel free to include them, a screenshot of the iTero scan or whatever else it is.
I was going to ask you if you use an iTero scanner for that to show better detail or not.
Yeah. So, I mean, we've got iTeros in every office. I'm actually upgrading a lot of our iTeros, this new Lumina. So they twisted my arm on that one. Don't get me wrong. I like the iTeros. I do think that they're very helpful. But we've got a few different ways that we can show patients, concerns or issues. We've got the Overjet software, now in all the offices, so that can be very helpful as well. I just had a meeting with our entire group, talking to the doctors and hygienists and assistants and treatment coordinators, and there's a lot of cool features that you can utilize that my team had not been utilizing yet. So this is the thing, guys. Like, I'm not seeing patients. I don't have to know how to use Overjet to go diagnose. Now, I might at some point, I might have to fill in somewhere, but like currently I'm not seeing patients. So I don't need it for that. But like, as the owner of my group, I need to know the features and products and functionality of this software so that I can talk to my team about, are they using it effectively? Are we getting the most out of that type of a thing? So just keep that in mind, guys. Like, just because you don't have to be an expert, like same with billing, man. I am not an expert at insurances and billing, but I have learned enough that I can ask the right questions and look for the right things to make sure my team, both external and internal, that does know a lot more about insurance, to make sure that they're actually doing the right thing. So you have to know enough about different things of being a business owner. You don't have to be an expert. You don't have to necessarily do it yourself, but you have to know enough that you can analyze what others are doing and essentially grade them on their performance or recommend changes, or realize if you've got the wrong person doing it because they're just not doing a good job of it. So yeah, anyways, so side tangent there. So that's the letter in a nutshell. Every after 2 weeks.
I think you said this. How much collections did you get right away from?
So again, we literally just roll this out. So it took me, first step was telling the team about this new idea. Second step was having my partner run some stuff through ChatGPT. Third step was me editing the letter. And I didn't do it in one sitting. I made some tweaks here and there. And then third step, once I had the letter perfect, was in customizing it for each doctor and office. I changed the doctor name, address, email addresses, things like that. And then the fourth step was emailing each of the offices with their custom letter and a new system that I had written about exactly how we're going to use the letter. So that just happened a couple of weeks ago. Some of these first letters have just started going out over the last couple of weeks, but within the first week of sending these letters out, I got a text from one of my treatment coordinators. Hey, a patient just called about that letter we sent, and I just closed them for a $30,000 implant case. So even at 74 cents per stamp, it's going to take a hell of a lot of stamps to get to that $30,000 case we just closed. Now, would we have closed that case without the letter? We might have. The normal call follow-ups, text follow-ups, we might have closed them. But I'll tell you what, especially if you have an older patient base, especially if you're doing a lot of full arch implants and dentures and stuff like that, which probably means, again, and not that younger people don't need these services, because they do, but it's skewed more on the older side. So if you've got an older patient base, if you're doing the procedures catered more towards older generations, not all, but some don't like using their cell phone, don't like answering calls from numbers they don't recognize because they think that they're spam, don't check their voicemail, and may or may not use texting or like to use texting. So, you've got to realize that your efforts may or may not really check or use their email. But I'll tell you what, everyone gets mail at their house, and almost everybody, if you get a letter in an envelope with a handwritten name and address on it, you're probably going to at least open the letter. At this point, I think I've gotten pretty good at spotting spam, knowing what spam, although I almost made a really bad mistake one time. I almost threw away a super important letter from the bank. But anyways, in general, I think we've gotten pretty good at spotting what a spammy letter looks like. But if your team can take the time to just handwrite those, handwritten doctor signature, little handwritten note on it. And again, these letters, they're not like overly pushy. It's just basically, hey, I'm checking in. I wanted to see if you had any other questions. Obviously this is a priority. We want to make sure we take care of it before it gets worse, in effort to help make it easier for you to take care of the problem before it has a chance to get worse. So that's the call to action, guys. This is why I've been so successful at marketing, besides having a great marketing agency, Matt's company, Energize. Besides using a great marketing agency, a lot of my marketing strategy comes around calls to action. When I've got my Invisalign party, I shoot those ads, that selfie video. Hey, want to win free Invisalign treatment and straighten your teeth in just about 6 to 8 months? Just send me a message on Instagram to learn more and see if you qualify. So very short to the point. If you want to win free Invisalign, you've got to send me a message. Our free whitening ads. Hey, want free teeth whitening? Send a message to claim one of the vouchers, whatever it is. The letter. Hey, want to find out what your discounted treatment plan is? Send us an email or send us a text. So you've got to have those calls to action And whether it's internal marketing, which is what we're doing here with these letters, whether it's external marketing, if you don't have a call to action, you're not going to get people responding like they should. Would you agree with that, Matt?
Yeah. Is this standardized operation now? You're keeping this across all practices? It impressed you so much, like this is a standard fixture now in all Andrew Vallo practices?
100%.
So, guys, like Andrew has enough humility to like listen to all these experts in the marketplace, and Andrew gets exposed to a lot through the podcast. And when he hears something, he's, I'm going to try it. Guys, you have to realize when you try these things, you have to execute them to 100% and really believe in them and get behind them and keep it going until you figure out the different things. Like Andrew's trying different versions of the letter, different practices with custom messages. And the reality is, one thing someone's going to think who's listening to this is no one answers mail anymore. Well, guess what? This guy doesn't answer mail. I hate it. I go to my mailbox, 3/4 of it is crap I don't want. Like, I wish it could be like email where we get a spam folder where we could put all the spam. But the other day, I did get a letter from my dentist, and it was the only letter in the pile I opened because it was from my dentist. It was from someone I actually knew. When I go through my letters, my mail, if it's from like, I do like 2 piles, junk, and then the people I actually know or the things that are important, and then I work my way through it. And I got a letter saying apparently I owed money for my cleaning, which I didn't realize. And that was the one letter I opened first. So like if you get a letter from a medical provider that you're going to that you value, even if you're like not a mail person, you're probably opening it.
That's what I'm saying. If it's a postcard, obviously you don't have to open it, but I feel like people just glance. And I'll tell you, when I do postcards, there are big calls to action on them for sure. But, unlike a postcard, like you actually have to take the time to open the letter. It would be great if we could track this, like, how you can track the open percentage of text messages or emails or whatever that from campaigns. It'd be great to track. Obviously there's no way to track what percentage of people open letters. I would bet it's actually a very high percentage. I would bet very small percentage of people just throw away these letters without opening the envelope with the handwritten thing and the stamp from the dental office that they're going to. So I would imagine very high open rate. Now, what's the conversion rate? It's a good question. Now, here's the thing. I like with the calls to action sometimes having it be like a surprise. So like I toyed with the idea of like, we're offering you an extra 10% off your dental treatment or, whatever it is. But I was like, if I tell them what it is, they're less motivated to reach out because they already know what it is. But if you say, I've authorized the team to extend a special discount on your treatment to receive an updated treatment plan with the new discounts added, send us a text or message. Now, there's a little bit of mystery there, and they're wondering, like, what is this new treatment plan? I don't know 100%. I haven't A/B tested it or anything like that. But based on my experience with marketing externally and internally, I have a feeling we're going to get a higher response rate by leaving it vague and people wanting to know what the new discounted treatment plan is.
This is a really easy trick. And there are these pro tips are out there. Like a lot of times you guys like look to the outside and like, how can I get more patients? Right. But I find rarely we look inside to, are we really servicing our patients at the highest level and getting all the production done that our patients need? Right. I think internal marketing gets very neglected. A lot of docs want to grow their collections and they go right to investing to outside marketing. Well, there's 2 things here. There's profit centers in your practice you're missing out on, and this is a really good one. And second is, if we're going to spend this money outside marketing, we need these systems and processes in place to make sure we're getting all this production done to service our patients to the highest level. So it does 2 things. It takes advantage of an internal profit center, and it's also another way after you make that investment on outside marketing to make sure you're getting the most out of every patient.
Yeah. Well, and I honestly, I think in today's day and age with so much technology and guys, I love technology. I'm not a tech expert, but I love the fact that I can use mostly user-friendly technology to make our dental practice lives easier. But in the age with so many automated text messages and emails and everything else, I mean, honestly, I think people receive a lot less mail these days. And while truthfully, this is a sales mail. I mean, it is us trying to sell patients on moving forward with their dental treatment. it's a little different than most of the kind of cold call spam sales mail that they get. So it's not, I would not put in the same category as the other junk mail. And I think because people get so few legitimate, letters and things these days, I think it actually has a bigger impact. I think it has a bigger impact now than it would have had 20 years ago, because it's just different. It's something that, 20 years ago, every practice was sending out mail to their patients because, email and text messaging and all that wasn't, I mean, not that it wasn't a thing, but it wasn't as prevalent, and there wasn't all the automation and things like that. So, back then everyone was doing it. Now, a lot of people have stopped doing it. And I actually think that it's an opportunity to kind of capture more of your existing patient base. And let's think about cost, honestly. Piece of paper, I honestly don't even know in bulk what those cost. Less than a penny, I'm sure. Stamp, 74 cents. Let's call it 75 cents. Time, doctor can sign a giant stack of these when he's got a break in between patients. There's really no doctor time that's in there. And then whoever on your team is writing the addresses, okay, yeah, maybe they spend an hour a week writing, addressing some envelopes, getting them ready to mail out. So whatever that team member is paid, $25 an hour or whatever. And then, 1,000 stamps is $750, or 1,000 of these letters, $750 plus a little bit of time. I mean, think about it. Reaching 1,000 of your existing patients that need treatment for less than $1,000, and all it takes is a couple of those moving forward with a bigger treatment. You get a couple of those $20,000, $30,000 cases, even if nobody else responds. I mean, it's such a no-brainer. So anyways, guys, if you're not doing this, like I wasn't doing this until a couple of weeks ago, I highly recommend looking into doing something along these lines. First of all, if you don't have set systems for follow-up with patients with unscheduled treatment, that is your first step. If you don't have if your treatment coordinators are not tracking who's saying yes and who's saying no, if they don't have some kind of spreadsheet or system to follow up consistently with patients, and it can't just be like, oh yeah, they follow up when they have time.
Yeah, that's no good.
No, you've got to set time. So for us, it's 2 days call, text, 2 weeks letter, 2 months call, text. So if you don't have set systems to do this, and I will tell you, we do have some automated texts that go out, and sometimes they work, but it's less effective. So, I think this is something where you really need people, because it's really hard to close treatment over text. Like you kind of need so like when these patients send the text or send the email, we email them their updated treatment plan. They try to set a time to like go over the treatment plan with them on the phone. So it's like, hey, I'm going to email you your new treatment plan. What's a good time for you this week? And like literally the treatment coordinator will block off 15 minutes on their schedule to go and make that call and talk to the patient through the treatment plan, because that's how we close, or sometimes even come back in the office if they have more questions for the doctor, they want to help them apply for financing or things like that. So
This is a great follow-up process. A lot of times people think just follow-up is like text messages and phone calls and email. I think this letter is another avenue of follow-up that's not used, which is mail. And I think it creates a sense of urgency. And I think the visual of showing the problem is very motivating because it puts it forward in their mind. So I think this is a really awesome pro tip that you can execute tomorrow, grow collections, and have it honestly relatively cost you very little money.
yeah,
So it's a really good found profit center for very little money. We have to wrap this episode up. Hey guys, thank you so much for tuning in. Me and Dr. Vallo don't allow sponsors on the show. No one can pay to get on. And it's something that we do for the community. So please like, follow, and share. That means a lot to us. And thank you guys and have a great day.